There are several features of the M22 that make it easy to use both for the novice practitioner or the expert laser surgeon. Although the treatment parameters are on board and you can press a button and go, depending on your patient, if you're a more advanced laser practitioner, it's very customizable and you can pick your pulse count, you can pick your delay between pulses. You can also make the system do things that you want to do. It's very flexible. So by that, it's a wonderful device for treating your everyday patient. Let's say a patient with hyperpigmentation, or you wish to do a photofacial, which we do all the time. If you're a novice laser or IPL practitioner, you press the button, pick the right treatment parameter, and go to town. If you have a little bit more experience and you want to tweak it a bit, go ahead and extend that pulse delay, change out the filter, increase the fluence to your liking, and the M22 gives you the ability to do that. There are several technologies built into the M22 that help further that approach, and a lot of that is built out of Lumenis's 20, I believe, plus years in IPL. They invented the technology for the most part and have the most experience with how to make it work at the bedside. So let's take, for instance, OPT, right? Optimal pulsing. So if you know that you've got a target that you want to heat and get rid of, the M22 allows you to do that in the most logical and clinically sound way through its inherent onboard technologies. And these are things that you can't get in a lower priced system. The ability to string pulses together as well. Similar to how we do in, say, pulse dye laser, it's common that we'll pulse a lesion twice. Well, the M22 is smart enough to allow you to have high fluence, high energy treatment pulses strung together in a very similar fashion to stack pulses. And that sort of ability at the bedside really leads to incredible clinical results, way more than I was used to seeing with any other IPL system. Well, you know, I live here in Central Florida, and we have a lot of hyperpigmentation and sun damage. I would say that the number one thing we do is what we call, and many people call, a photofacial. Although there's not a button to press called photofacials, you really have your options either using the lentigo setting or what's called age spots telangiectasia. Both work great. And you're sort of treating a little bit of this and a little bit of that, and that is one of the true magical things about IPL. You know, laser systems confine you in a way to treating a specific target. One of the beautiful things about IPL, and this is important for somebody who's maybe just starting out their laser or cosmetic practice especially, is that you can treat somebody with hyperpigmentation and blood vessels, basically a lot of sun damage, in one treatment session. You don't have to treat them with multiple devices or bring them back and do it a few times over. In my practice, we use aminolevulinic acid in combination with that sometimes, and we have a lot of flexibility depending on how photo damaged the patient is. But I tell you, these are the people that get amazing results. My typical patient would be a female in her 50s who has had a lifetime of sun exposure out on the golf course, on the water. Usually this is a Fitzpatrick 2 or 3 female. So those are the patients that we see and treat, and they're very happy, and we tend to see their family or their church group or their social group because they look so much younger and really with not a whole lot of effort. It's really about taking a few years off the clock and helping them get rid of all that sun exposure that they've accumulated over the years. And you know, I see a lot of patients here in Central Florida. When I was a resident in the Midwest, you know, I certainly saw a lot of those folks too, so it's not exclusive to the Sun Belt down here. You know, I'm lucky enough in my practice to have a CO2 laser, the Lumenis Ultra Pulse as well. You know, some patients do great with that, but a lot of people don't need to go that far, and they do wonderfully with IPL in just 1 to 3 treatment sessions. We do some hair removal with the device. We have the Lumenis Light Shear Duet, which covers the bulk of our hair removal, but there's that occasional patient, random patient that wants to have a little bit more improvement, and so we do use the IPL for that. Certainly, if you were a young practitioner or starting up a cosmetic laser practice, I would certainly use the IPL for hair reduction, permanent hair reduction. Just having that one device in your practice should cover the waterfront. So it does a lot of stuff. You know, I run a specialty laser clinic, so we have a lot of tools on our tool belt. But if you were just starting out, really wanted to open up a cosmetic practice, you know, the M22 is the way to go. Multi-sequential pulsing is very important for destruction of intended targets. We know that very well through our work in pulse dye laser, where we'll string pulses together. We call that pulse stacking. And for the last decade or so, we've used pulse stacking to help heat the target progressively, so protecting it, but thermally destroying it. We can use that same kind of technology in IPL, and Lumenis does that through multiple sequential pulsing. What this means is pulsing a target more than once with a rest period or delay in between, which allows the target to cool, protecting it, so you're not having the risk of post-inflammatory hyperpigmentation, and scarring. So by using the sapphire tip, which is cooled, and allowing the tissue to cool between pulses, we're protecting it and also increasing the efficacy of the device. It's a huge feature of the M22 and really allows us to knock it out of the park results. Another great feature of the M22 is that the expert filters are right there in front of you. So if you wanted to take that patient from, let's say, a Fitzpatrick 3 to a Fitzpatrick 2, you needed to change from a 560 to a 515 expert filter, it's right there in front of you. And it quite literally is easy as pressing standby, changing out the filter, pressing go, and you're on it. So there's nothing to change out. You don't have to shut the system down, replace any treatment heads, tell the patient to wait a second. You can make those decisions on the fly. And for somebody with more experience with IPL, you can broaden that pulse duration just by pressing a button. And the interface, like with the Lightshear Duet, is so easy and user-friendly. Press an up button, you can increase the pulse delay. Press an up button, you can increase the fluence, you can decrease the fluence. You can do it in the middle of a treatment based on how the patient's doing. So it's very easy and safe for somebody maybe without a whole lot of experience in IPL, but it's also very customizable and effective in somebody that is more experienced and seasoned. I would absolutely recommend the Lumenis M22 as a startup system. I've written before about how I did things a little bit backwards when I started, and I think there's a compulsion amongst residents just out of training to do that. We spend all that time studying in residency, what the thermal relaxation time of certain targets are. I mean, down to the millisecond. We know the diameter of thermal targets in our sleep at night. We know so well what coherent beams are all about and when they were discovered and how they're used, and we have experience with all these fancy laser wavelengths in our training. So we have this need when we get out in the real world to work with these coherent beams of light. We want to use lasers, and that's great. The problem is lasers limit your ability to treat people. I bought a pulse dye laser right out of residency. That's a great laser and is the workhorse of dermatology. The problem is it really limited me to treating patients with vascular problems. So it was very expensive, it was very effective, but it limited me, put me in a box. I also bought a YAG laser right out of residency to treat leg veins and to do permanent hair reduction. It was an expensive device, to be sure, and again, it worked kind of, but it put me in a box. I was in a therapeutic box. So in Central Florida, as an example of any town in America, we have a lot of patients with photo damage. They have sun damage. They have lentigos, they have pigment spots, they have melasma, and I didn't have any treatment for them. So I'd spent a lot of money, and I had these great tools at my disposal, but I was sending a lot of people out of my practice to people that had IPL systems. So one of the pieces of advice I give young practitioners is to start broad and then specialize if your cosmetic laser practice takes off, if you decide that's what you want to do. I can think of 5 or 6 people in the last year that were starting to get into cosmetics, and you should in dermatology because you have such a captive audience. And their first choice was the Lumenis M22. And the reason is that you can treat so many things right out of the box. You don't have to send people away, send them to your friends, and just, oh, I know this one guy who's got this one laser. You can treat flushing, you can treat telangiectasia, you can treat pigment spots, you can do photofacials, and you can do permanent hair reduction, all with one device at a pretty good entry point. You're not spending an arm and a leg. You can usually afford this, given that you're treating so many things. And it's very small and very mobile, and you can move it around, and it's flexible even for a small office without a whole lot of space. It really doesn't take any maintenance. You don't have to have the guy down to mess with it and open the top, and you really just kind of fill the little thing with water and you're good to go. So for somebody that's starting out, IPL is the way to go. In my humble opinion, I think the Lumenis M22 is the big cheese of this device.